The government is committed to fully equipping detention and prison settings with sound health facilities and provision of non-discriminatory health care services to inmates. Principal Secretary, State Department for Correctional Services Salome Beacco noted that a holistic health care approach is paramount for the inmates as it will contribute to the successful reintegration upon completion of their sentences.
First African Conference on Health in Detention has been held in Nairobi that saw delegates drawn from various African countries attending. The conference was necessitated by the high number of mortality recorded each year, majorly associated to health complications on the inmates.
One, we have the challenge of overcrowding, which I found is across board. And we have the challenge of funding. And out of these challenges, now we get, this is what exacerbates the problem that we have of diseases in our correctional services.
Principal Secretary, State Department for Correctional Services Salome Beacco, who officially closed the 3-day conference, noted that the ministry is actively supporting efforts aimed at promoting an integrated approach to healthcare within the prisons to tackle pervasive health issues.
The department is mandated to provide safe custody and rehabilitation for both convicted and unconvicted prisoners. This broad mandate cannot be realized without provision of quality health care for those in our custody.
So strengthening health systems, including in detention, and leveraging the digital transformation to get there requires shared solution and collective action.
This while noting that mental health plays a crucial role before and after incarceration, hence ought to be prioritized.
Incidentally, for the State Department for Correctional Services in Kenya, this year's theme is mental health and wellness for effective service delivery.
There is a connection between the body and the mind. So the physical health cannot be looked at in isolation without due regard to the mental health.
Some of the key recommendations include upholding and strengthening the rule of law, including Nelson Mandela Rule, which states that prisoners ought to be treated with dignity. The recommendations further called for more efficient and ethical practices for health providers working in prison settings, prioritizing mental health for inmates, and equality and non-discrimination in healthcare provision within detention. Opito Chemtai for Easy Friday.